You step out of the shower, grab a towel, and as you dry your legs, you notice something unsettling. Your feet just do not look or feel the way they used to. Perhaps they feel unusually cold, or there is a faint, persistent tingling in your toes. Maybe the skin around your heels has developed deep, stubborn cracks that no amount of lotion seems to fix. It is incredibly easy to brush these changes off as the unavoidable wear and tear of getting older, wearing uncomfortable shoes, or spending too much time standing. But treating the physical changes in your feet as a simple cosmetic issue is one of the most dangerous biological mistakes you can make. Your feet are not just a structural foundation. They are the ultimate, microscopic early warning system for your entire metabolic engine. Because your feet are located at the absolute furthest point from your heart, the blood vessels and nerves running into your toes are the longest and most fragile in the human body. When your metabolism begins to fail and your blood sugar starts to rise, these microscopic pathways are the very first to suffocate. Today, we are going to bypass the generic medical advice and go deep under the skin. We are going to decode the 9 specific biological warning signs in your feet that loudly signal your blood sugar is out of control. By understanding the mechanical failures causing these symptoms, you can catch diabetes long before it destroys your systemic health. The phantom tingling and numbness. The first and most common warning sign is a sensation that feels like you are wearing an invisible, tight sock. You feel a persistent tingling, a mild pins and needles sensation, or a creeping numbness starting in your toes and slowly moving up your foot. This is not just poor circulation. This is the biological onset of diabetic peripheral neuropathy. When your blood sugar remains chronically elevated, the microscopic glucose molecules violently attach themselves to the proteins inside your blood vessels. This creates destructive compounds called advanced glycation end products, or AGEs. These AGEs physically choke off the microscopic capillaries that feed oxygen to your nerve endings. As the nerve suffocates, the protective coating around it, called the myelin sheath, begins to dissolve. The electrical cables in your feet short-circuit, sending phantom tingling signals to your brain, or worse, going completely silent and causing dead numbness. The midnight fire. The second warning sign often strikes when you are trying to sleep. A deep, intense burning sensation in the soles of your feet. Many seniors kick the blankets off their feet at night because the burning becomes intolerable. This is the progressive, aggressive stage of the nerve damage we just discussed. When the nerve fibers in your feet are actively dying from sugar toxicity, they do not just go quietly numb. They misfire. They send chaotic, panicked electrical signals to your brain. Because your brain has no context for a dying nerve, it interprets this chaotic electrical static as intense heat and severe burning pain. If your feet feel like they are on fire when you lie down to rest, your nervous system is sounding a blaring metabolic alarm. The stubborn, silent wound. The third sign is a terrifying mechanical failure of your immune system. A blister, a scrape, or a small cut on your foot that simply refuses to heal. Normally, when you get a cut, your blood vessels dilate, rushing white blood cells and healing factors to the site to repair the tissue. But when you are pre-diabetic or diabetic, 2 catastrophic things happen. First, the thickened, syrupy, sugar-laden blood cannot physically squeeze through the damaged capillaries to deliver the white blood cells. Second, high blood glucose paralyzes the immune cells that do manage to arrive. To make matters worse, bacteria feed exclusively on sugar. An open wound bathed in hyperglycemic blood is a biological buffet for infection. A simple blister that takes weeks or months to heal is a screaming indicator that your cellular repair system has completely collapsed. The desert heel. Warning sign number 4 is severe, unyielding dryness and deep cracking, particularly around the heels. You can apply heavy moisturizers and thick creams every single night, but the skin remains deeply fissured and brittle. This is not a topical moisture problem. It is a neurological failure called autonomic neuropathy. You have autonomic nerves in your feet that subconsciously control the sweat glands and the natural oil production of your skin. When high blood sugar destroys these specific nerves, the biological lubrication system in your feet completely shuts down. The skin loses its structural elasticity, dries out from the inside, and physically tears open under your body weight. The fungal takeover. The fifth sign hides in plain sight inside your shoes. Chronic, relentless fungal infections. This often presents as thick, yellow, crumbling toenails or persistent, itchy peeling between the toes, commonly known as athlete's foot. Most people treat this with over-the-counter sprays and ignore the root cause. Fungi and yeast are highly opportunistic organisms that require a massive amount of glucose to survive and multiply. When your blood sugar is chronically high, your sweat and bodily fluids literally become sweet. You are actively secreting the exact food source the fungus needs to thrive. If you have a stubborn, fungal infection that refuses to clear up or constantly returns, it is often because your bloodstream is providing a non-stop supply of fuel. The vanishing hair. Warning sign number 6 requires you to look closely at your toes and lower legs. If you notice that the hair on your toes, the top of your feet, or your lower calves has completely stopped growing or vanished entirely, your body is making a desperate biological sacrifice. Hair follicles are highly metabolic structures. They require a constant, rich supply of oxygenated blood to grow. When high blood sugar damages the endothelial lining of your blood vessels, a condition called peripheral artery disease, PAD, your body has to ration its limited blood supply. The brain intelligently restricts blood flow to non-essential functions, like hair growth, to conserve oxygen for the critical muscle and bone tissue. Bald toes are a literal sign of oxygen starvation in your extremities. The temperature drop. The 7th sign is a drastic, localized change in temperature. Your feet feel like blocks of ice, even in the middle of the summer or when you are wearing thick woolen socks. This goes hand in hand with the vascular damage of PAD. Your body heat is distributed entirely by the flow of warm blood from your core down to your extremities. When the arteries in your legs become stiff and narrowed by glucose-induced plaque and inflammation, the warm blood simply cannot reach your feet in sufficient volumes. If your hands are warm but your feet are chronically freezing, you are experiencing a severe mechanical blockade in your lower circulatory system. The shiny, paper-thin skin. Warning sign number 8 is a distinct change in the actual texture of your skin. The skin on the top of your feet and your shins begins to look incredibly tight, shiny, and almost translucent, like tissue paper. This is a condition known as dermal atrophy. Because the microscopic blood vessels have been destroyed by sugar, the deep layers of the skin are completely starved of nutrients and collagen-building proteins. The biological fabric of the skin physically wastes away. It loses its natural wrinkles and creases, pulling tight over the bones. This shiny, paper-thin skin is incredibly fragile and is at an extreme risk of tearing open from even the mildest friction. The structural collapse. The 9th and final warning sign is the most devastating, and it occurs when the diabetes has been silently progressing for years. It is a sudden, noticeable change in the physical shape of your foot. Your arch may completely collapse, making the bottom of your foot look like the hull of a rocking chair. Your toes may begin to curl into unnatural positions. This is a severe condition called Charcot foot. Because the nerves are completely dead, you cannot feel pain. As you walk, you suffer microscopic fractures in the delicate bones of your feet. Because you feel no pain, you continue to walk on broken bones. The bones disintegrate, the joints collapse, and the entire structural architecture of your foot is permanently destroyed. Your body is a brilliantly designed, deeply interconnected machine. It does not fail without warning you first. It flashes the warning lights in the places you are least likely to look. The numbness, the burning, the vanishing hair, and the stubborn fungal infections are not isolated annoyances. They are a direct, desperate communication from your vascular and nervous systems. They are telling you that the syrupy, sugar-laden blood is destroying your microscopic plumbing. If you look down and recognize 2 or more of these signs, you must not ignore them. Do not simply buy a new pair of shoes or a stronger foot lotion. You must take this specific physical evidence directly to your physician. Demand a comprehensive metabolic panel, including a hemoglobin A1C test, to see the true, 3-month average of your blood sugar. Demand a test of your fasting insulin to see how hard your pancreas is working. This information is rooted in advanced clinical endocrinology, podiatric medicine, and vascular biology. It is strictly for educational purposes and is never a replacement for the personalized diagnostic care of your physician. You have the power to stop this metabolic damage, but you must first acknowledge the alarms your body is sounding. Take exceptional care of the foundation that carries you through this world. Listen to what your feet are telling you, and I will see you in the next video.